Okay, Carol, I think you can
All
start.
right. Good morning, good afternoon, or good evening to everybody. My name is Carol Howe. I'm an associate professor of nursing at Texas Christian University, and I'm going to start off our workshop today with a brief PowerPoint just to kind of settle us all into this health literacy space. I know that you're all attending the conference, but I wanted to frame our project. And I'm sharing my screen. Hope it doesn't rotate, but it might. All right, the name of our project is Innovate to Communicate. We developed a health literacy workforce training program funded by the National Networks of the Library of Medicine. And I'll have each speaker introduce themselves as they come forward during our workshop over the next 90 minutes. Oh, it turns, sorry. So Innovate to Communicate, our workshop objectives are to really spend some time learning about communicating using evidence-based health literacy practices. For example, plain language, chunking information, and using teachback. So we focus our attention on ways to integrate health literacy into structures, processes, and quality measures. So as we practice these health literacy practices, we're also going to show you some tools that you can use if you'd like to integrate in some quality improvement in your organization. And then the last is to effectively use these resources to promote a health literate organization wherever you may work, whether that's in a hospital, a clinic, or in a public health community setting. So why health literacy training? Well, we know 1 in 3 patients that we see has low health literacy, and we know that low health literacy has been associated with increased and longer hospitalizations. For patients, they find that it's more difficult to manage their chronic conditions. We see that patients with low health literacy have more medication errors, increased mortality, and also they experience avoidable readmissions. Persons with low health literacy also tend to have more emergency room utilization. Rasu and his colleagues estimated that low health literacy costs $215 billion annually, and that is our most recent estimation of the cost of low health literacy. So Healthy People 2030 recently came out with new definitions for us. They define it into 2 different types, personal and organizational. So personal health literacy looks like what we have seen before with a little bit more added to it. And they defined it as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy, I'm sorry, I have to keep moving your faces. Organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So what does this mean for us as healthcare providers? So these new definitions emphasize people's ability to use health information rather than just to understand it. There's a focus on the ability to make well-informed decisions rather than appropriate decisions. It also incorporates a public health perspective and also acknowledges that as organizations, we have a responsibility to address health literacy. And that's where we as healthcare providers come in. We have a responsibility to address health literacy from our actions and our behaviors and interactions with patients. So how does your organization meet these goals, we ask? So Innovate to Communicate, here's an overview of it. We developed a whole workshop and self-learning modules for training. And the hope is to train all healthcare disciplines in both clinical frontline roles as well as leadership roles. We know that leadership training is really important to increase the organizational health literacy of an organization. We've created engaging self-learning modules, exemplar videos, as well as some clinician and patient role play. And we've incorporated in all of this a communication observation checklist, which is right from the Agency of Healthcare Quality and Research, their Health Literacy Universal Precautions Toolkit. They have these tools available online. So we wanted to show you those tools as a way that you can use if you'd like to do a health literacy quality improvement program in your organization. We also incorporated in a Kahoot quiz. It's interactive, just to help reinforce lessons learned from the self-learning modules and the workshop itself. So that's my introduction. We're going to now walk you through parts of the Innovate to Communicate training. So the first is we developed 2 self-learning modules. One is a Health Literacy 101, and it also has an extended class standards module with it. So it's a twofer in that one. And we've created a self-learning module of health literacy for leadership. Again, we're really emphasizing the need for leadership, executive, as well as middle management, really being involved in health literacy efforts in organizations. I'm not showing you these self-learning modules. We are in the finishing touches with them, but once we are done them, they will be available for use really by anyone that would like to use them. And we'll have them on a website for people to grab them. I am now going to turn over the workshop to my colleague, Dr. Ashley Franklin. She's going to cover medicine review. We highlight 2 health literacy strategies throughout the workshop. So this is the first one.
Hi, thank you, Carol. My name is Ashley Franklin. I am a nurse as well and also teach in the nursing school at Texas Christian University. And I'm going to introduce an exemplar video for you around the concept of a medicine review. And so the video we'll show is a nurse visiting with a patient who is admitted to an acute care facility. And in the 6-minute video, what you're going to see is the nurse has talked to the patient about what medications or medicines that they need to review, including prescription medicines and also over-the-counter or supplements. The patient has all of the medicines brought to the hospital, thankfully. And so we're able to set out those medicines so we can view the bottles. And then during the medicine review, the nurse asks the patient to pick up the medicine bottles and explain what the medicine is, when they take the medicine, and then also give a demonstration of how many medicines or pills they take at one time. The opportunity to go one by one through each of these medicines allows the nurse to clarify the instructions, and also if problems come up to try and figure out why the patient might be taking the medicines in a different way, or why they're not sharing the same mental model in terms of how that medicine is used on a daily basis. So it allows the nurse or other provider to provide some just-in-time instructions to clarify how to take the medicine, and then have the patient teach back to make sure that their understanding is complete. So this is an adult case exemplar. The video lasts almost 6 minutes. What I'd like for you to do is pay attention to some of the language, because after the 6-minute video, we'll turn around and work in breakout rooms to practice using some of that language appropriately. And so by appropriately, what I mean is using terms like medicine instead of medication, primarily because medicine is easier to understand. And it's, to me, a more broad term that doesn't mean just prescription medicines, but includes supplements and over-the-counter medicines and things like that. So I invite you to watch this video first and take note of some of the language. And then after the 6 minutes is up, we'll do some breakout rooms. George, my name is Ashley again. I'm the nurse who's going to be with you for the next few hours. I know there's been a lot going on lately. The next thing we're going to do is called a medicine review. It's really important that I understand what medicines you've been taking at home and exactly how you've been taking them. So I'd like to go through all of your medicines.
Oh, okay. I don't think there are any new meds.
Did you bring a medicine list or your medicine bottles with you to the hospital today?
Yes, I have them in my bag.
Great. Go ahead and pull those out. I'd like for us to be able to go through them one by one. Is it okay if I pull up a chair to sit down at your level?
Sure.
Do you know if this is all of the prescription medicines you take and also the over-the-counter ones?
Yeah, I think so. I'm a pretty organized person. I usually keep my medicines in a basket in my kitchen at home.
Good. May I look at your bottles?
Yes, of course.
Okay. Well, what I will do is enter your medicines into our electronic health record, and then I can print out for you a schedule of your medicines that would help you to fill a pillbox organizer if you'd like to once you leave the hospital. Let's go through these bottles one by one. And as we do, I'd like you to tell me what medicine it is, why you take it, and also how you take the medicine, like what time of day you take it. Let's start. You can choose the first one you take. What's that?
This one is atenolol.
Okay. And when do you take atenolol?
In the morning before breakfast. Most of these are before breakfast.
Good. Can you open that bottle and show me how many of the atenolol you take?
Yes. I take one.
Good. Let's create a done pile of medicines that we've already been through. Show me which one you take next.
The nalopril is also for my blood pressure, but I take 2 of these before breakfast.
You know what? You said you take 2 before breakfast. It looks like on this label, the instructions are to take 1 pill 2 times a day. I want you to know that this is exactly why we do a medicine review. And I'm really glad that we caught this. Sometimes if you take too many blood pressure pills, you can get symptoms like feeling dizzy or really tired. So I want to make sure the instructions are clear. I'm thinking I will enter the instructions to take 1 pill 2 times a day, which means in the hospital, you'll take 1 pill in the morning and then 1 pill in the evening. Tell me, do you ever have symptoms of feeling dizzy or like you're too tired?
Yes, I do feel dizzy in the morning. Usually after I've had my coffee, maybe an hour or so after breakfast. I just thought it was my coffee.
And it could be, but if it's the medicine, I want us to get that straight so you know exactly how to take it when you leave the hospital, and so you don't have those symptoms again. So just to reiterate, I'll enter this in my electronic health record to take 1 pill in the morning and 1 pill in the evening. And we'll get it straightened out while you're here.
Okay, that's fine with me. I've only had this medicine for about a month now, and my body needs time to get used to it. I've tried to manage my blood pressure by decreasing my salt intake, as well as I've started walking in the morning 5 days a week.
Good for you. Those are great things too. And I know these medicines will also help to keep your blood pressure down. It sounds like you're doing a good job. Let's go ahead and keep going. Show me what medicine you take next.
Well, this one is hard to pronounce. I take it for cholesterol.
Good. Is there anything else you take in the morning before breakfast?
The last one on my list is metformin for my blood sugar.
Can you tell me, do you take your blood sugar at home?
I do every morning before breakfast.
Good. Can you tell me when you take this metformin?
I take metformin twice a day, one in the morning before breakfast and the other one in the evening.
Okay, let's go ahead and move that one to the done pile. What about medicines you take that are over the counter? Tell me what else is in your bag.
Yes, I get these from the grocery store. I take 1 baby aspirin for my heart to help prevent a heart attack. I take one vitamin also in the morning before breakfast. And I take one allergy medicine before breakfast.
Thank you for pulling all of these bottles out. Is that everything from your bag?
That's it.
Great. All right. I saw a question in the chat during that video that I wanted to respond to quickly. And it was about if healthcare providers in busy acute care settings have time to do this type of medicine review with each patient. And so I'm happy to offer my perspective on that. I really appreciate your question. One way we set this up was at time of admission. When we might be doing this type of medicine review. I can also offer from my experience as an organ transplant coordinator that we did make time for this. We often sequenced it at time of discharge because we are getting our patients ready to go home on a very new medicine regimen. But I think it does happen in several settings, probably in a different fashion, depending on the type of unit and the type of staffing that are there, whether it's bedside nurses or educators specific to that patient population. But I appreciate your question.
Yeah, and I would say in clinic, we try to do a medicine review one time per year. And it's, I mean, ideally we would do it all 4 times that we see them in diabetes clinic, but you're right, time is a factor, but one time a year is enough to catch. And it's interesting, as you do medicine reviews, you might find an alarming amount of errors. I would say sometimes a third to half of patients there's some sort of adjustment you have to make or teaching that you have to do related to their medicines. So I just encourage to incorporate in that 5 minutes. I do want to apologize that there are no closed captions on this video yet. There will be, and our plan is to have them there. We just have to know where this video is going to live before our videographer incorporates in the closed captions. The other note I want to make is Ashley in this video and our patient actor, we made this during the pandemic and they were never in the same room together during the video shoot. So it looks like they're interacting, but they actually never saw each other. So that's just a fun fact. Tracy, did you want to add anything?
So I would say, from my perspective, I've spent most of my career in acute care, and we do very much expect there to be medication reconciliation in every ER visit and on every admission. And we do catch quite a few errors. In some cases, the patients have been there in the past, and you can check in the EMR, although that won't catch everything, because certainly something could have changed since the last time. But often we have patients who have never been seen in our facility. So you're really starting from scratch, and it is an alarming number of times that you'll catch something that is not being taken as it's intended or is being missed altogether. So I think it doesn't take that long, and we do find it to be extremely important to do on admission.
I see 2 other questions in the chat that I want to acknowledge quickly before we move into breakout rooms. I can maybe offer this, Teresa, if you want to start getting our breakout rooms set up, that might be appropriate use of time. The first question I noticed in the chat was what to do if a patient doesn't bring their medicine bottles. I think with Carol's example, and I believe Tracy was speaking to this too, my personal experience is that if you have the medicine bottles, you're probably more likely to catch more of the errors. When Carol said that, up to a third of the medicines a patient may be taking incorrectly. And I heard Tracy reference, you can use sometimes the old electronic health record documentation if your patient didn't bring medicine bottles. In many of the clinics in our area, one thing that helps our patients to remember to bring their medicine bottles is they actually get a bag from the clinic that says, bring this bag to your appointment. and on it, there are more instructions to bring all of your prescription medicines and supplements and over-the-counter things too. So those types of visual reminders have helped in clinics in our region in North Texas to increase the medicines brought to appointments. The other question I saw was about motivational interviewing. And I'll admit that we didn't necessarily set out to want to use motivational interviewing in our video, although that comes really naturally to me as a nurse. So it may have been infused unintentionally, but I appreciate the question. All right, Carol, would you mind advancing the slide? We are going to go into 4 breakout rooms next. And on the slide that you can see, there is a QR code. And if your phone is able, I would invite you to take a picture of that QR code because it will open a link to a document that we'll use in the breakout room. We're carrying this patient, Miss George, forward from the video you watched, but going to fast forward in time. So she had been discharged from the hospital, a segment of time elapsed. She was started on a new medicine for cholesterol management called lomidopide about 2 weeks before. And now she's in an outpatient setting here for an appointment and a medicine review. If you've hovered over the QR code and opened it, there is a long document, several pages. What we're going to do is a role play. We're gonna ask the team to brainstorm how to organize teaching for this new medication called lomidopide. And we've given some teaching points in the handout. So it's going to be a group kind of consensus. And then towards the end, we'll do a role play and ask someone in each group to be a provider and someone to be the patient perspective. If you scroll down to the end of the document, what you'll see is an observation tool, which is one from the AHRQ that Carol hinted to earlier. And so for those in our breakout rooms who aren't in the provider or patient role, we're going to ask that you kind of score the role play on the observer tool and then offer feedback. So again, if you want to open that QR code, that might be helpful to you. And Teresa, would you go ahead and put us into breakout rooms?
Sure. The handout, Teresa, is in your lesson plan if you need to share the screen. When you're in your breakout room, you can share it on your screen if people are having trouble pulling it up on their phone. And we're going to be in this breakout room for, I have to pull up the lesson plan, but the problem is my whole, here, I'm going to do it.
I have it pulled up, Carol. We had planned on 10 minutes.
10 minutes in this breakout room? Okay.
Yeah.
Can you unshare your screen, Carol, so I can ask a question?
Yep.
If anyone needs the interpreter to go into your breakout room, could you raise your hand? Okay, I don't see any hands raised. So I'm going to just do a random assignment. If anyone needs anything, please message me in the chat.
Right, I hope you all enjoyed that first breakout room activity and chance to think about prioritizing the way we deliver patient teaching materials related to medicine review. We are going to continue to use some of these health literacy tools and actually switch to a pediatric exemplar and use a new skill called teachback. So Tracy, I think I'm supposed to defer to you on this one.
You're muted, Tracy.
It must have muted me when we came back to the full session. So I apologize for that. For those of you who were not in my breakout session, I am Tracy Adame. I am the Director for Research and Clinical Innovation at Medical City Dallas. And I'm excited today to talk to you a little bit about how these techniques can be used not only with adult populations, but with pediatric populations as well, and how they can be adapted to teaching of both pediatric patients, but also to their family members and their caretakers. So in this particular scenario, we really are interested in utilizing teachback methodology to ensure that not only are they understanding, but they know how to incorporate it into their actual daily living. So as part of this, you will see a video that is actually showing a provider teaching a pediatric patient directly that allows you to really look at how to break down large amounts of knowledge and chunk and check into small pieces so that you can continue to clarify and check again if there are any misunderstandings before you move forward and cover any additional information. And so that really is the heart of teachback. It's really a test on how well you explained information, not a test necessarily of just patient knowledge. We do want them to have knowledge, but we want them to be able to be informed in acting in their daily lives. And so this really allows you to chunk into small pieces and check as you go along to make sure that that has happened. Once we finish watching this particular video, we will then go again into breakout sessions in which we will do a scenario role play that actually is a patient that is post-operative. And in that case, we focus heavily on the teaching of the parent on how they are going to incorporate and take care of the patient once they get home. So you can see that in these two scenarios, they're a little bit different, and they show how you can scale and use the techniques in either situation.
Does anyone hear audio? I don't hear it. Carol?
I do not.
Stroke is my stroke.
Oh, well, that's good to hear. It's always good to have improvement when you try really hard at something, right?
Right.
All right. Well, I want to talk to you a few minutes about managing your low blood sugar. So now that you're getting older, you can do some things for yourself. So do you know what it feels like to have a low?
Yes, my stomach hurts and I'm really shaky and I'm really hungry.
Yes, a lot of kids tell me that's how they feel when they're low. So I'm glad that you know what it feels like. But it's always best to check your blood sugar if you think you're low. Do you usually check your blood sugar when you're low?
Sometimes, I don't know.
Well, that's okay. I want to tell you why it's important to check your blood sugar when you think you're low. We want to know what your blood sugar is doing. Sometimes you think you might be low, but you're not really low, less than 70. Sometimes you're not able to check your blood sugar because you don't have your glucometer. So it's always best to treat it if you think you're low. Can you tell me in your own words why you think it's important to check your blood sugar?
I need to check my blood sugar if I feel like I'm low because I need to know what my blood sugar is doing.
Yes, exactly. So if you think you're low, you want to check your blood sugar and make sure it is actually low. So now I want you to think about the 15-15 rule, which means if your blood sugar is low, less than 70, you want to take in 15 grams of carbs and wait 15 minutes. Then you check your blood sugar again. If it's still less than 70, then you want to take another 15 grams of carbs and then what?
15 minutes.
Yes, you want to wait 15 minutes. So when I say 15 grams of carbs, that means either 3 glucose tablets or a juice box. All right, well, let's take a break. I know I just went over a whole lot of information with you. So I want to make sure I did a good job explaining to you the 15-15 rule. Can you tell me in your own words what the 15-15 rule is?
Okay, if I feel low, then I need to eat 15 grams of carbs. If I still don't feel good, I need to eat more carbs until I feel better.
I'm sorry, I need to explain the 15-15 rule a little bit better to you. So you got the first part correct, where if you feel like you're low, you check your blood sugar, and if it's less than 70, you take 15 grams of carbs, and then you wait 15 minutes. Then you need to recheck your blood sugar and see if it's actually low again. And then if it is low, you take 15 more grams of carbs. So it's really important to wait that 15 minutes before you recheck your blood sugar. Because if you keep eating carbs without checking your blood sugar, what do you think would happen?
My blood sugar can go high like for hours.
That's right. It's really hard to wait 15 minutes because your stomach's hurting, you might feel shaky. So it's really important to remember the 15-15 rule to make sure you wait that 15 minutes. So if you're low, less than 70, you take 15 grams of carbs and then wait 15 minutes. If you're still low, then you take another 15 grams of carbs and then what?
And then wait 15 minutes.
That's right. So I think you got it. And so I want to give you a cheat sheet. So if you forget what the 15-15 rule is. But before we finish, I want you to explain to me in your own words one more time what the 15-15 rule means.
If I'm low, I need to check my sugar first, actually. And then if I'm low, I need to eat 15 grams of carbs or 3 glucose tablets and wait 15 minutes. If I'm still below 70, then I can eat 3 more glucose tablets and wait another 15 minutes.
All right, you got it. Oh, here comes your mom. So let's explain it to her again.
All right.
Great. So in that video, we were able to see that once the information was chunked into smaller pieces, you could really assess where in the communication and where in the teaching there might be an opportunity versus waiting to the end when, if you identified an opportunity, you may not know where in the process that there was an unclear understanding. So that was a great example of chunking information and doing teach back to ensure understanding before moving forward. Now we'll move to the pediatric teach-back scenario, and just as we did last time, there is a QR code here for you to hover on and to use your cameras to be able to pull up the pediatric scenario, where we're going to be looking at the parent of a 9-year-old boy who was post-operative from having a tonsillectomy and adenoidectomy and is getting ready to imminently go home. Obviously, pain management is a concern at that time, and in this case, you really need to make sure that that is under control, or the patient is subject to having issues with dehydration. So we do have, again, the 3 tools from AHRQ. We have the observation form for the observers. There is a self-assessment form for those of you participating in the role play to be able to look at that. And in the future, when you incorporate this in your facilities, you're able to have a patient feedback form as well to really involve them and inform changes and continuous improvement. So Teresa, are we ready to go into our breakout rooms?
Let's spend a few minutes just to debrief on that last teach back. What were some insights that people got? Our group, Gwen did a wonderful provider. She took everybody's input and incorporated it into a really coherent, but yet staged, segmented teach, where she then checked in to make sure that the mother understood. Right, Gwen? What was it? What was your thoughts in putting that together?
Well, full disclosure, I'm a family doctor, so I have some experience with this.
I could tell.
But just really making sure that it is in words that are understandable, and also, like you said, putting it on myself to make sure that I'm explaining it clearly and making sure that I acknowledge that the information itself is hard. And I'm not asking you to explain it back to me because I think you're not smart, but it's because the information can be complicated and it's important to do it correctly and making sure that they understand why it's important to do it correctly.
And Sean in our group was very worried about using the word alternating schedule. She thought that could be really confusing to parents, like alternating. Do I do the Tylenol now or the ibuprofen now? So Gwen came up, the medicines, you're going to take turns. They're going to take turns. You're going to give Tylenol, then the next time it's Motrin's turn. And then, and I thought that was a great way to explain it.
Yeah, that was cool.
Okay. I think
Great working with you, Gwen.
Thanks for being a great patient.
Okay. The last is, I don't know who here, we should have told you to download the Kahoot app. Do any of you have the Kahoot app?
It's super easy to download. You can do it like in.
So if you beam on that QR code, so lesson to self presenters, we put that up first and say, hey, download this while you're listening to our intro.
So if you want to go ahead and pull up the Kahoot, I can, if no one else can, I can at least sign in as a person.
Me too. I have to find it on my phone, but. Okay.
Hit continue as a guest.
Yep. We're just going to keep moving. So it's loading it. So if you have the Kahoot, you're going to enter in this PIN number.
So this is our kind of chunk and check. It's our way of evaluating that you've gotten the information that we've been teaching you from this whole presentation. And so we're going to just put you through the Kahoot game and then you'll be able to play. So we want to wait and see if a few more people sign in, or do we need to get going, Carol?
I think we have a couple more minutes.
Okay. Andrea says she's trying to download.
You just need to go to the website and enter that game pin. You don't have to download the app.
Oh yeah, you can do that on your computer.
But where
Or
do
on
you
the
enter
phone, I
that?
guess, too.
Where do you enter the PIN?
Yeah.
It'll-
yeah.
If you go to the website, it will give you a place to just enter the pin and join the
Yeah.
game.
My screen looks like this, like it does here, but I don't see a place to enter the.
Sean, are you on the app? You'll see little 4 squares at the bottom of your phone. Do you see like blue, green, yellow, red?
Hit those.
Hit those. It says like enter PIN.
Okay. Nope, I don't have it. I'll just watch online. Oh, I have to take the test though, huh?
No,
Well,
no,
no, you
don't
can
worry.
just watch.
Don't worry.
Okay.
Okay.
Now,
Right.
this is really for the participants to have fun. It is not a test of your knowledge. It's just a fun way to review. So what they'll do is put you through some different questions. So here's the first one, and look on your phone too, because it's there, and that's where you hit the color that is the right answer. So print health information should. Good. So 23 of us got it right. That's awesome. Carol, if you'll hit next.
Oh, sorry. It's all this print. So if you had done the self-learning modules, you would know all these answers.
So just go ahead and see if you know it.
Blue.
18 got it right. So yeah, the self-learning modules teach you step by step about health literacy. So you will know the answers to all of these questions.
So images, graphics, photos, and health information.
$18 of us got it right. You guys are doing great for not having taken the, Emily took the lead over Gwen for not having taken the modules yet.
We're gonna
I
do
say-
one more after this, Teresa.
I say red.
Okay, 22 got it right. So are we gonna cut it short, Carol? We won't get to see who won. Well, I guess we'll see who's winning at the time we get done. Gwen's back on top.
All right, that just gives it, because we want to give enough time for, oh, I have to stop the cahooting. Oh, here,
What'd you do?
I'm just turning on FaceTime and all kinds of stuff by accident. Like, oh my goodness. Sorry.
No, I'm getting the hang of it now.
Okay, so Gwen ended up winning the 4 out of 4. Woo! Okay, so that is just the review. There's actually 12 questions that we that are in that quiz. And then we move to the next piece, which is the evaluation. Carol?
I'm working it. I got all kinds of things going on here. Like I'm pushing different things in my.
While she's doing that, may I ask a question?
Yeah.
Is there one thing I noticed is that I don't see any like written samples of like a not badly, but a highly complex content compared to easy literacy content. Does that exist somewhere, or do we just make it up as we go along? Because I haven't.
So there is a brief sample of that in the learning modules. It's not an intense instruction. There are some available online. I believe CDC has one that is a plain language instruction. I personally use readability.com to help me to revise documents. There's a fee to have a subscription, but it's pretty nominal. I think it's like $48 for a year for one person or something like that.
Okay.
Yeah, and also the CDC has a guide called Simple.
Plain and simple.
I'm gonna find it for you and put it in the chat.
Okay. Thank you guys. I found that I got stuck in this position of being the health literacy writer, but I didn't really have any instructions. So I'm just doing it from common sense mostly. And I just wanted to know if there was some guidance somewhere.
The health department in Texas uses the Hemingway app, which is free, and you just go to it and you put in your language. It'll tell you what grade level it is and what suggests things that you need to change as far as passive words or, you know, too difficult of a sentence, that sort of thing.
Thank you.
Free. Yeah.
Yeah.
Good. Thank you.
Yeah, that's what Readability does too. And it looks like Rewordify is another one.
Yeah, I'm looking for Simply Put because I'm just looking for the original CDC because they actually have all kinds of examples.
They actually have you revise a document and then figure out, you know, how you did.
Awesome. Thank you so much.
Yeah, here, I'm going to put it in the chat and you can grab it, okay? So why don't we do questions and answers until 25 after, and then we'll do the eval, Teresa?
Okay, well, that was our first question. So thank you.
So notice that it says https://stacks.cdc.gov. If you grab that, that's a thing called Simply Put. And so it's a great, they're saying, if you're trying to say this, consider saying it this way. The CDC also has a plain language glossary. So instead of hypertension, high blood pressure, instead of gastrointestinal, it's stomach, so things like that.
And here's one from the NNLM that Sean put in the chat as well.
Yes, that's excellent too. Very good.
So any other questions? Carol, do you see any in the chat?
Does readability help? Okay, wait. Does readability help with the SMOG guidelines? Isn't readability, SMOG does pick up readability, correct? But the other thing, in not just thinking about readability of print materials, that's a whole nother workshop we could do. So if that's important, we could try and offer that at IHA next year. But in terms of readability, there's also the need to look at the usability of a material. So it's not just the grade level, but it's also the white space, chunking information. And that you can assess your materials, using, and it's in the toolkit. What is it called? There's one that's called SAM, Suitability Assessment Materials. Oh, the other one is called PMAT, Patient, I'll get it for you.
It's, yeah, patient education.
PMAT, right.
But it's understandability and usability is what PMAT measures.
Right.
And I've used that on several of my research projects to evaluate materials that are targeted at a certain niche of education. So on maternal mortality or maternal health, postpartum materials, and then more recently, we're using it on, what are we using it on?
Okay, so anyway, I put the PMAT link in there.
Healthcare websites. We're evaluating healthcare websites.
And I've used the PMAT too. So here's a question. Are there any tools to assess how patients and families learn best, or individual health literacy?
So that's a great question. I actually just had that question from a clinician here in Fort Worth, Texas, who was wanting to measure the health literacy of the seniors that her patient population. And there are no like cut and dry ways to measure people's health literacy. There are some tools out there, such as the newest vital sign. Typically, we don't try to measure people's health literacy. We use the universal precautions from AHRQ. So you can Google that if you are interested in finding out more about that. But basically, with universal precautions, you just start at a low level of understanding and simplification. And then you build up as you see that that person is either seeking more information or understands enough to be more detailed. So that's basically what I told her, and sent her a link to the AHRQ Universal Precautions Toolkit. But really, and if you ask other health literacy experts, we really, when you try to assess health literacy, it sometimes can be shaming for people to admit that they can't read, or that, even with the newest vital signs, reading a ice cream container label is somewhat challenging and is hard to understand, even if you have good health literacy. I'm a registered dietitian. It's something we struggle with teaching people all the time.
Yeah, and as health literacy people, everybody really focused a lot on assessing individual clients' health literacy, because then we thought we could teach to them. But there's been a lot of data that shows it just shames them. And also there is a lot of associations between lower health literacy and race and ethnic minorities. And so we're just adding stigma on top of stigma within the healthcare setting. So sometimes people will measure health literacy randomly in their clinic to get a sense of who comes to their clinic, but more as a comprehensive look at their clinic. You can certainly get that data elsewhere as well. But really, people, like Teresa said, focus on universal precautions. The last question is Flash Kincaid within Microsoft Word accurate? So I find that it will assess written materials about 2 grade levels above, for example, the Fry test. So I use the Flash Kincaid a lot because it's convenient. It's right there on your Word document, but I always assume that if it says 7th grade, it's really 9th grade.
Yeah, that's why I use readability.com. I always discourage people. I've not used that rule, Carol, but I discourage people from using the Microsoft Word. But if it's the only thing you have, then you might as well. Mm-hmm. And as far as when our toolkit will be available, it will be soon. We plan on uploading it onto a platform where it will be easily accessible and free to all. So if you want to stay in touch with us, feel free to do so, and we'll let you know, or we'll let IHA know when it is.
We can continue to take questions, but we'd really appreciate some feedback from all of you. So again, here we are with a QR code. If you could beam in on that and give us some feedback. There are some standard questions that come from the National Library of Medicine, as well as some questions that we've added in there. Remember, all the evaluation that we're collecting is anonymous. We're just really interested in aggregate information. But in the meantime, we can continue to answer questions. Okay, so Rachel's asking, she totally understands the whole stigma with assessing health literacy, but she's saying, are there tools to assess learning preferences? You mean like, you know, do they like to learn kinesthetically, visually, auditory? I'm thinking that's what you mean, Rachel?
Yeah, Ashley and Sean have both shared some resources for that.
It was a question that came up at our organization. Should we be doing an assessment of, I work at a pediatric hospital, of families as they come in to ask them, how do you best learn, or are there tools that we should be using? And it's such a broad topic. I didn't know if there was anything out there that I didn't know of, but I can absolutely see how trying to assess for health literacy specifically could add stigma. But is there something we should be assessing, or do we just try to cover all bases with everybody?
Yeah, I know when I work with patients, I really just ask, how do you learn best? I just really ask them. I also really try to be very interactive and have all different ways of teaching, which I'm sure a lot of you already do as well, where, you know, you have, so one of the things that I would have offered in our role play is that in addition, like somebody had said for the acetaminophen, you know, that you would give a handout, you would give some sort of visual with that. So really offering, you know, a visual, you're verbally explaining, maybe perhaps, obviously, if it's a psychomotor skill, you're actually demonstrating and asking for a re-demonstration back. So there's lots of different ways that you can integrate in all the different kinds of learning. Certainly some people, and we all have clients that have a whole range of background and experience and knowledge. Some want to read the research studies we're reading, and others just want to know, what do I have to do today? So I don't know, unfortunately. Teresa, Ashley, do you know of any tools to do about, I'm going to assume everybody's on the evaluation that's going to go on it, correct? So I can see everybody. But Ashley, do you happen to know of any tools that assess learning style?
I put a link to something called the VARK, V-A-R-K. It's free. It's about a 20 or so question. It's ironically, you do have to be able to read to do it, but it will give you a score. Like if you think of your piece of the pie, if you had 20 pieces of pie, it would say, oh, you answered that 12 pieces work for kinesthetic learning. And where you only said 4 of your pieces work for reading, and maybe the other 6 pieces work for hearing.
I want to take that for myself.
I use it in class sometime with undergraduate students when I'm trying to decide what type of
handout or exemplar to use. It's pretty easy. You can have, it's web-based, not app-based, but I put the link in the chat.
Thank you.
So someone's asking for a link to the evaluation in the chat. Carol, can you do that quickly?
Is this going to beam me out? I have to go. Hang on.
Yeah.
I used to have a link and I don't know why I took that off. I apologize. I have to sign into my university, grab the Qualtrics link.
I can't see this little handwriting, but it looks like it's tru.cofi.qualtrics.com.
I don't know. Hang on. No, it's much more complicated than that. I think that's not it. Here you go. Thank you. I appreciate it. Because we have 17 people that have done the evaluation, but it would be great. Oh, there it is. How did you get it so fast, Katrina? You need to be on our team.
I will admit to getting it on my phone and then emailing the link to myself on my computer.
Yeah, I know. I had a text file link. I know it is. I actually think it's in my lesson plan, but I didn't want to go look to find out that I didn't put it there, blah, 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 blah. So I just went and grabbed it. So I appreciate it if you could click on that link and do the eval. We have a couple seconds left for more. I don't know if like this session just ends at 1:30, like, because we don't control the Zoom.
Right, I don't either.
George,
but thank you everyone for attending. It was a great experience meeting with all of you.
And no, it won't automatically kick you out.
Yes, right, George. Is that we're not going to suddenly all just beam out?
No.
So does anybody have any last questions before we? Yes, of course you can email us questions.
Are our emails available on our profiles? I think so.
Yes, okay, good.
All right, well, thanks everybody.
Thank you.
Fun.